H. Birthday. Okay, so good morning to one and all to join here for this YouTube session on viral latent infections. Okay, so as we know, the viruses are the second most common microbial agent is responsible for the disease in human. Okay, so next to the bacterial agent, the most common, the second microbial agent is viruses. Okay, that point we know. So viruses are intracellular in nature. Viruses are not having any specific cellular organization, and also it is not require the antiviral therapy always as a part of treatment. So these are all the common properties of the viruses that we know. Okay, right. Now first we are going to classify the viruses depends on their nucleic acid specificity. Okay, if we are talking about the bacterial agent, we are using the staining procedure to classify. If we are talking about the fungal agent, the morphology, the structure will be taken for classification. But coming to the viruses, okay, it is not easily stainable. It is not having the complete structure, so we have to use the core, nothing but nucleic acid for the classification purpose. So the viruses are mainly classified by their nucleic acid structure into the two. One is called as DNA viruses and RNA viruses. Okay, the classification. So DNA will be a double helical structure that we know. RNA will be a single linear strand, right? So DNA and RNA will be the two important, the nucleic acid specificity for the viral agent to be remembered. Okay, right, accepted. So in the DNA it have a double helical structure. There is a specific or the strong bonds will be there compared to the RNA. Okay, right. Now we know already the point as a basic. DNA and RNA will be differentiated in their one nucleotide, that is thymine will taken for the DNA, that is replaced by the uracil for the RNA. Okay, right. Now this is the base to be taken for the classification. Okay, right. Once the virus is infecting the human by the various modes of transfer, for example, the virus may be infecting the person by inhalational mode of entry. Okay, first one is inhalation. Okay, number two, it may be taken by the oral route after the contamination, right? The second possible infective route. The third one may be a direct contact. Okay, may be a direct contact, either cell to cell contact or with the help of vectors. Okay, so cell to cell contact or the vector contact, the humans are getting the infection. Okay, so these are all the methods by which the infection will be transmitted from the environment or from the other infective cell or from the vector. We are getting the infection of the viral agent. Okay, right. After the mode of transfer, the virus will be specifically replicate in the target cells. Okay, specifically replicate in the target cell. For example, in the case of hepatitis B or hepatitis C, the target will be hepatocyte, obviously. Then coming to the Epstein-Barr virus, the B lymphocytes will be the target. If we are talking about the varicella zoster, the lymph nodes and the skin cutaneous site will be the main target. So depends on the virus, it will be taking some target cells in the human for their initial replication as well as to make a acute presentation of the disease. Okay, so after the virus will be specifically binding it to the target cell, it will start with a acute infections. Okay, so acute infection will be dealing with the infection, replication, and it may be spreading to the nearby cells as well as to the other individual, and also it will be releasing out of the body for the next infective process or even within the host cell. So acute infection will be the primary one for the viral infection after the specific target cell. Very good. Now after the acute infection in the primary target cell, what are all the further outcomes? What are all the further outcomes to be taken after the virus is replicating in the primary cell? That is called as the decision point. Okay, number one, the virus in the acute infection not yet completely clear, it may progresses, point remember, it may progresses continuously either in a slow manner or in a very rapid manner. We call it as a continuous or a chronic infection. So from the acute infection, what are all the possible outcomes we are now discussing? Okay, so one will be a chronic infection. It is not clear yet, it may be moving into a further progression either continuously or intermittently, to remember. Yes, this is one possible outcome. Okay, now coming to the second possible outcome from the acute infection, if the immune system will be very effective, point remember, the immune system will be very effective, will be completely clear the virus without allowing any chronicity, without allowing any further replication, it will be completely clear from the target cell, we called as recovery. So the complete recovery will be taken after the acute infection as a second outcome or the decision. So the first one, it is not clear and moving continuously. The second one, the clearance will be in a complete process to be taken as a recovery. Depends on either we are giving the treatment from outside or the virus will be effectively tackled by our immune system and the host cell effectiveness. The complete recovery is the second rule to remember. Okay, right. Now if we are coming into the chronicity, the chronicity may be taken into two further process. Okay, yes, once is depends on, yes, the continuous replication along with presentation. Okay, but the second one, it is continuous survival without presentation. Okay, the chronicity will be there, but there is a slight difference in the chronicity. One is a continuous replication will make the presentation of the virus. The second one, it is replicate or survive but without making any presentation. So that particular, the second component will be considered as, yes, latency. Okay, now what are all the characters of the virus to be assessed for the latency or the latent period? Point to remember, number one, the virus will be present in the host cell as a dormant state. Point remember, as a dormant state. Okay, what do you mean by dormant? It is remains inactive for a longer period. That is the second point. Okay, it is remains inactive for a longer period. So remains inactive means what happened to the replication? Yes, there is a no replication. Okay, strictly speaking, there is a no replication of the virus because it is remains inactive within the host cell. Inside the host cell as a dormant state, we call it as latency. Okay, now what is the third criteria to be fulfilled by the pure latency? We cannot able to demonstrate the virus by taking the sample by any laboratory test. So no lab test will detect the virus from the sample because the virus remains inactive. Okay, so the first one we may not able to select the sample, that is cells. Then even if we are taking, we may not able to detect the specific virus by a laboratory test. So that will be taken as the third criteria. Then what about the fourth criteria? The virus will get reactivate to produce a new symptoms or response due to some external stimuli or the signals. For example, a extreme temperature or the heat or cold or some metabolic dearrangement or due to some excessive physical exercise, okay, or some intramuscular injections, okay, or it may be some immunosuppression, otherwise called as any other microbial infection further. So these are all the some important stimulus by which the virus will be activate again to make a new presentation. Okay, that is the fourth point. So now what are the criteria to be taken as a latency? Point number one, virus is present in the cell as a dormant state. Point number two, the virus is not having any replication, it is remains in a inactive is number two. Number three, we cannot able to demonstrate the viruses by any laboratory test, it is type 3. Number 3. Number 4, the virus will be reactivate and produces a new response or new disease which is slightly or completely differ from a primary infection is called as reactivation. Okay, so if the virus is fulfilling this all four criteria, we can consider as a latent viruses. Okay, inside the cell, remains inactive, no replication at all, and we may not able to demonstrate the virus. Then the last one, we are going to activate, or the virus will be get reactivated and produce a new response to be remembered. Okay, so these are all the four criteria to be taken for the assessment of the viral latency. Okay, right. Now what are the examples to be taken? Okay, that will be very important. We are giving some examples of the viruses will have a latency. The classical example is herpes family. Okay, the classical example is herpes family. Okay, so herpes family will be consist of HSV1, 2, varicella, Epstein-Barr virus and Cytomegalovirus. So the latency will be very classical and the important character of the herpes family of infections. Okay, right. Now first one we are going to take up is the herpes simplex. Okay, so we are going to take up the herpes simplex. Okay, that is HSV1 or HSV2 we are taking. So now the HSV1, it is otherwise called as a oral HSV. Okay, so that will be making the primary presentation and followed by latency, then reactivation. Similarly, HSV2 is called as a genital HSV, that also responsible for a primary infection, then latency, then reactivation. Okay, right. Now HSV1 otherwise called as oral, HSV2 otherwise called as genital. Very simple. Now, what is the important flow to remember here? Any viruses will be responsible for a primary infection after get exposed. Okay, we discussed already the mode of transmission, starting from inhalational mode, starting from the oral transfer and other thing. So the primary infection will make the disease. After the primary infection, one of the outcome is dormant state. We call it as latency. Then after the latency, the virus will be get reactivated. Depends on the stimulus from the outside. Okay, either the temperature or the hormonal disturbances or the exercise or the intramuscular injection or any other microbial infection by which the virus will be get reactivated further. Okay, so this is the flow of the viruses will be starting from the primary infection up to a reactivation process. In between we call it as latent period. So latency is after the primary infection. Latency will be forward with the reactivation procedure. Okay, so latency, it will be a longer period. Okay, it is starting from months to years. Okay, most of the time it will be in the years only. So the months will be very rare. So the years together will be the main important the period for the latency to be remembered. Okay, right. So now the HSV1 primary infection responsible for conjunctivitis, oral lesions, pharyngitis. After the primary infection, the HSV1 will be going to take latency in trigeminal ganglion. Okay, that will take up with trigeminal ganglia. Okay, now coming to the HSV2, mainly responsible for a genital lesions. So genital ulcer or the discharge and the genital manifestations are more common with HSV2, right? Now after the primary infection of HSV2, that will be going to latent in sacral ganglion. Okay, so sacral ganglion will be the site of latency in HSV2. So HSV1 trigeminal ganglion, HSV2 is a sacral ganglion by which the virus will be taking the latent period. Okay, right. After the latency with the years together, virus will be going to reactivate from the ganglionic site into their distribution. We call it as a dermatomal component. So the dermatomal distribution from the trigeminal ganglion and the sacral ganglion by which the virus will be reactivating. So during the reactivation of HSV1, it may develop again in the oral lesion. We call it as the cold sore, which is a painful, a blister formation mainly in the face. Then coming to the HSV2, it will be again reactivating from the sacral ganglion, depends on the immunity as well as the stimulus from the outside into a painful, a genital ulcers or the genital lesions. So now if we are comparing the primary infection with reactivation, primary infection of the virus mostly a self-limiting, okay, mild to moderate manifestation. But coming to the reactivation, most of the time it is not self-limiting, that require the treatment for the control, as well as the disease will be severe or the manifestations will be high compared to a primary infection. Okay, that is the common rule to remember. Primary infections of any viruses in the list of latent viruses will be a self-limiting and mild to moderate. After the latency, the virus will be reactivated, always considered as a severe and require the treatment. Very simple. HSV1, the primary infection, is a self-limiting, but HSV1, the reactivation is called as a cold sore, will require acyclovir therapy, because the genital or the oral lesions, it is activated from the ganglion in a dermatomal distribution that will be irritating the nerve roots, will make excruciating pain or the severe pain lesions. Because of this painful lesion, the patient necessary to receive the drug, then only the viral replications are get minimized, so the patient will be comfortable in their pain tolerance. Okay, so primary infections are mild to moderate and self-limiting. Reactivation is severe and require treatment. So the first classical example is HSV1 and HSV2. Okay, right. Now you can see HSV will be present, will make the primary lesion, and in the ganglion, that is a trigeminal ganglion, as a latency to be established, then it will be just reactivate, okay, into the new manifestation that will be severe and painful. Okay, right. Now coming to the herpes type 3 is called as varicella zoster. So from the name of the virus itself, we can able to assess varicella is a primary infection, zoster is a reactivation. Okay, varicella is a primary, reactivation is called as zoster. Very simple. Primary infection is by inhalational mode, replicate in the respiratory tract and the tonsils, and moving into the lymphatics and the bloodstream, responsible for the lesions like fever or the rash and the blisters. Okay, right. Now after the virus is making the primary lesion, it going for latency in the trigeminal and dorsal root ganglion. From the latent period or the latent side, the virus will be get reactivated. Thus reactivation of the primary lesion after so many years, we call it as zoster. So zoster will be otherwise described as shingles or zona. Okay, so shingles or zona, it is otherwise called as zoster. So the varicella will be taken as a primary infection, zoster will be taken as a reactivation. In between, it will be present in the trigeminal ganglion or a dorsal root ganglion as a latency. It will take very a long duration to remember. Very simple. We know varicella mainly in children up to the age of 15 years. But zoster will be happening only at the age of 40 or 50. So that means it will have a long latent period in the ganglionic site. During the latent period, we may not be able to demonstrate the virus by collecting the sample. More or less we are not doing. So the reactivation is not always a mandatory outcome. It may be developing the reactivation or it may not be, but the rule will be the reactivation may be due to some external stimuli to remember. Okay, yes. Okay, now if we are combining both HSV1 and HSV2, the lesions will be oral or genital. In varicella there will be a skin lesion. It will be present as a primary and going for reactivation. This reactivation is always considered as a severe one compared to primary. So primary lesions are self-limiting. Reactivation will be from the dorsal root ganglion. Okay, in all the three, HSV1, 2 and varicella, it will be more severe, necessitated always with acyclovir therapy. So even zoster will be treated with acyclovir, 800 mg divided doses, similarly with HSV1 and HSV2. Okay, now coming to the next herpes family of virus is Epstein-Barr virus. Epstein-Barr virus is also will be causing the disease by inhalational route or mainly by the salivary droplet transmission. It is primarily binding in the B lymphocyte and oropharynx. Okay, so B cell and oropharynx will be the primary binding site. So after the primary binding site, virus will replicate and will make a primary lesion we called as infectious mononucleosis is a primary infection. Okay, after the primary infection, the virus will be going to make the latency in the B lymphocyte itself. So within the B cell, the virus will be present as a latency. So after the latent period of very long years, it will be reactivate into, yes, reactivation means always it is severe. It will be completely making the cell changes. Once the cell morphology will be changed, we call it as transformation of the B cell into a cancer cell. So B cell transformation will happen because of the virus will be dormant in the same cell for a very longer period, by which it will be reactivating into a B cell cancer, nothing but a Burkitt's lymphoma. So the primary lesion is called as a infectious mononucleosis. The reactivation will be described as the Burkitt's lymphoma or a malignancy, nothing but the transformation of a B lymphocytes, to remember. Okay, now coming to the cytomegalovirus. Okay, compared to the herpes simplex, varicella and EBV, cytomegalovirus, even the primary lesion itself, mainly in immunocompromised individual, that will be dormant mainly in the salivary glands and the renal system or the kidneys. Okay, so virus will be dormant mainly or the latent in salivary glands and the kidney. Then after this, virus will replicate to make the disease later on. Okay, so the primary infection will involve the reticuloendothelial system, liver and spleen will be get involved. Later on, it will be going to latent in the salivary glands and the kidneys. But one specific point to remember, virus will be taking some cells or the organ as a latency for the survival for a longer duration, but it may not have any disease to the particular cell, to remember. So CMV will be present in salivary gland and kidney as a latent infection. It only allow the virus to present as a reservoir. It may not make any disease to the latent cells. So kidney, it is not involved in CMV. Mammary glands or the salivary glands are not developing any disease in cytomegalovirus infection. So the cell will be utilized by the virus only for the purpose of survival. Okay, right. We can see human cytomegalovirus latency will be mainly present in the salivary glands and the renal system, that involving the activation, that is CD34 progenitor cells. So once it is moving into a terminal differentiation, that may going to form a lytic lesions after the reactivation. So we call it as cytomegalo inclusion manifestations, because it is making the lytic process, to remember. Okay, yes. Now coming to the well-known example of the latency followed by reactivation is measles. So the primary infection in children by the inhalational mode of entry, we called as a fever, and the rash development is called as a measles. Okay, so the primary infection can be prevented by the vaccination, and once the measles infection occur, that will provide a lifelong immunity for the individual. If the person is infected with the measles in the younger age group, the virus will be dormant in the lymphocytes and activate into SSPE, that is completely a fatal outcome, but the strong association with measles reactivation. Okay, the outcome of SSPE is 100% fatal. We cannot able to save the individual by giving the therapy or the modification, but we have to confirm the condition is due to the measles reactivation. Okay, now coming to the retroviral infections. So retrovirus, otherwise called as the HIV syndrome, okay, it will be slightly differ from the other viral latency, because during the latent period we may not able to detect the virus, as well as it won't make any manifestation and replication. But coming to in the case of retrovirus, we can specifically use the word it is a clinical latency, not pure viral latency. What is the meaning of the clinical latency? Virus will replicate, but it is not making any symptoms or the presentation. But replication is not in a high level, it is a very a minimum level or slow replication. So that's why retroviral latency will be slightly differ from the other viral latency by replication is in a minimized manner without any symptom that will be slowly will make the increasing the number of viruses. So specifically we can use the word a clinical latency. But other viruses what we discussed already, that is a pure viral latency. Okay, yes, you can see the latent infection means virus will be present here and there is a slow replication will happen. From the latency, if the virus will be moving into active, that will produces a new viruses. That new viruses are continuously going to infect the near cells, by which the increasing number of virus will happen. Okay, so the latency will be mainly to be remember the virus will be may not be detectable, but even in the latent site of or latent infection of HIV, we can able to demonstrate the virus as well as their antibodies during the latent period by some laboratory testing to remember. Okay, yes. So just to revise, the latency is nothing but the virus will be present as a dormant state. Okay, the minimum replication or the no replication and remains completely inactive manner. Depends on the stress from the outside, the virus will be reactivated to make a new manifestation will be described as a latency. We have two types of latency. One is called as a pure viral latency. The second one is a clinical latency. Okay, so pure viral latency means we may not able to detect the virus during the laboratory test and replication also nil. But clinical latency means the virus will be detectable along with their antibody, and also it will make a mild minimum replication that will maintain the virus in an active manner. Okay, yes. So latency is always coming after the primary. It will be progresses to reactivation. It is not mandatory, only depends on the stress and the immune status, the reactivation will happen. Okay, yes. So thank you for your patient listening. I hope this will be give some idea about the latent viral infection and how we can able to approach as well as the property of the viral outcome. Okay, so thank you, bye bye, see you.